Madam Speaker, members of the board and officers, delegates, colleagues, and guests, it is an honor to speak to this House of Delegates for the final time as AMA President. No president walks this journey alone. So before I begin my formal remarks, please allow me to recognize my fellow trustees for their leadership this past year. The many members of this House who have stood with me and encouraged me all these years. My partners at Kentuckiana Ear, Nose, and Throat, as I have juggled my clinical duties of continuing private practice with the demands of this office. My family and friends, who have often given honest feedback, sometimes maybe too honest feedback. I thank you all. And our AMA management and staff. They are the ones that make all of this happen and everything between our meetings work. Please join me in recognizing and thanking them. And most of all, the one person who I absolutely continuously depend upon, my partner in everything, my spouse, Christy. Now, those of you who remember my days as Vice Speaker and Speaker will not be surprised to hear me say, play the video.
I don't have to tell you things are bad. Everybody knows things are bad.
So, I want you to get up now. I want all of you to get up out of your chairs. I want you to get up right now and go to the window, open it, and stick your head out and yell, I'm as mad as hell, and I'm not going to take this anymore!
I'm mad as hell, and I'm not going to take it anymore!
I'm mad as hell! I'm not going to take it anymore!
From the tone of that video, you might have already guessed this is not going to be your typical presidential address. For those of you expecting the usual humor from me, I'm sorry to disappoint you, because tonight you're going to hear from angry Bruce. I think the times call for some anger. Because despite all the efforts of everyone in this room and our colleagues across the country, our healthcare system is failing in fundamental ways. It's failing physicians, and more importantly, it is failing our patients. I'm angry because the dysfunction in healthcare today goes hand in hand with years of dysfunction in Congress. I'm angry because physicians are bearing the brunt of a failed Medicare payment system. And while our pay has been cut 33% in 25 years, we see hospitals and even insurance companies receiving annual increases. Congress needs to know that there is no care in Medicare if there are no doctors. I'm angry because earlier this year, Medicare Advantage plans received a reward of a scheduled increase while we suffered yet another cut, or as a member of this House said, a gut punch to physicians. A healthcare giant suffers a cyber attack, releasing private health information for almost half of our country, pushing physician practices to the brink of financial failure, and then demands rapid payback of the loans that they made to these same practices. Reimbursement rates have been corrupted by a secretive third party for the benefit of the insurance companies and at the expense of physician practices. You bet I'm angry. I'm angry because these same insurance companies, which are making record profits, are wasting our time and putting our patients' health at risk by forcing us to argue with some bureaucrat over the care of our patients. Not long ago, a woman came into my office with a large tumor growing in her maxillary sinus. It was so large, it was beginning to push into her eye, affecting her vision. After a thorough examination, I determined that surgery to remove the tumor was the best course of action. So I sat down with my patient, and I explained to her the diagnosis, the treatment plan. She understood it would be a major surgery with significant risk, but she also understood that it was necessary. But a week later, her health plan notified her and me that the surgery was not medically necessary. Her insurance company said that she should be treated with an antibiotic and a steroid nasal spray before they would approve surgery. Are you kidding me? I heard the laughter. An antibiotic and a nasal spray to treat her tumor? Without seeing the patient, without talking to the patient, without completing even one single semester of medical school, this insurance representative determined that she knew more than the patient's doctor, a board-certified subspecialist. So what are our patients supposed to do? My patient was confused. She was stressed. When I called her to explain that I had spoken to the medical director of the insurance company and that I had indeed gotten authorization to proceed, she said, "I don't understand, doctor. You told me that I needed this surgery, but my insurance company says all I need is an antibiotic." Sadly, we all know cases like this are not outliers or isolated events. What insurance companies are doing to our patients is wrong. Stepping between us and our patients is wrong. Denying necessary and even life-saving care is just plain wrong. It's no wonder that so many physicians are frustrated at a system that is undermining our judgment and eroding our patients' trust. You better believe I'm angry, and I'm not alone. We've all seen the numbers. Physicians are retiring early, leaving the practice of medicine in droves, because eventually these frustrations and the loss in pay become too much to overcome, especially for physicians like me in private practice. As I travel across America, I've heard the stories of physicians struggling to keep their practices afloat, and the tearful stories of them closing their practices and how concerned they were for their patients after they have closed their door. In November, I told you that stories like this made me sad. Now, they make me angry. Our patients cannot afford to lose great doctors, not one more. Now, you know what else makes me angry? The physicians who sit home in their houses and their offices and complain. They complain about the broken healthcare system, and more bothersome to me, they complain about our AMA, often confused and clueless about what our AMA is actually fighting for. Instead of sitting at home complaining, join us in this fight. But here's the thing. Being angry for the sake of angry doesn't get us very far. We have to turn that anger into action. I know our patience is being tested by this new administration and Congress. It seems that every time we get close to a victory, new and equally urgent battles arise. The same House bill that brings us closer to finally tying future Medicare payment to the rising cost of running our practices also takes a step backwards by limiting access to care for millions of low-income Americans. Medicare, Medicaid, and the Affordable Care Act are literal lifelines for children and families for whom subsidized health coverage is the only real option. We must do all we can to protect this safety net and continue to educate lawmakers on how best to target waste and fraud in a system without making it tougher for vulnerable populations to access care. And we have we have launched a grassroots campaign that I hope all of you are part of to target the Senate as we work for improvements in this bill, and we urge you to join your voice to our call. We also must continue to educate Congress on why our nation should be working to bring down the cost of medical education, not erecting barriers that deter brilliant young minds from pursuing this noble profession. The proposed changes in student lending practices in the reconciliation bill would make it virtually unaffordable for many students. This is simply unconscionable in our country that has a shrinking physician workforce to confront our growing healthcare needs. And so I promise you that our AMA advocacy on this legislation will continue. And while I may be angry at our healthcare system as it currently exists, I'm also confident that in this House of Medicine, we can channel that anger into positive action. You see, despite our frustration, there are still reasons for optimism. AMA advocacy, amplified by the people in this room and our Federation of Medicine, has brought us close to achieving Medicare payment reform that ties future reimbursement to inflation, representing a foundational step forward for the reform that the AMA and all of you have been working for a long time. We urge the Senate to complete this first critical step on the road to permanent reform. I'm confident we'll get there, just as we're all angry at the slow pace of progress. Meanwhile, our AMA, with our Federation partners, has achieved significant prior authorization reforms in states across the country, and federal legislation has been reintroduced that will right-size prior authorization, add transparency, and reduce delays, and it has bipartisan support. We urge Congress to pass this important legislation and to pass it now. AMA advocacy, again with your help, has scored more than 180 scope of practice victories over the last 2 years. We have helped prioritize well-being by persuading a majority of state licensure boards and over 600 hospitals to remove stigmatizing language about past medical health problems from their credentialing forms. Our Joy in Medicine program continues to recognize hospitals and health systems that are setting new standards for physician support and blazing new trails for others to follow. As a result of so much of these efforts, physician burnout is now coming down. And just weeks ago, a federal court ruled that our lawsuit against MultiPlan to hold them accountable for its role in the price-fixing scheme could proceed. We are demanding an end to this conspiracy that is suppressing out-of-network payment rates below the cost of providing the care. But there is so much more that needs to be fixed right now. The film clip played earlier was from the movie Network. Some of you may have recognized it, where a fictional anchorman unleashes his anger. It was more than a cathartic tirade. It was a passionate plea against apathy. A largely forgotten movie, but a memorable call to action. And so I ask, are we finally mad enough that we're not going to take it anymore? Here's our challenge. While screaming from the windows feels good, it's not going to achieve the lasting results and change that our healthcare system needs. That change will come from uniting as a profession, channeling our anger into a unified voice. That is the work of our AMA. Finding consensus on issues with disparate opinions exist. That's why we are all here. Our disagreements and our debate aren't symptoms of dysfunction. They're emblematic of our democratic process in action. It's what makes this House and the policies that spring from it so powerful and so important. It's what intrigued me 35 years ago at my first meeting of this House of Delegates, and it has had me coming back ever since. I've read the obituary of a longtime AMA member recently. His loving spouse is here with us tonight. David was said to always be patient and kind and able to solve most any problem. His famous saying was, all you need to fix anything are the tools and the time. As physicians, we have the tools, our empathy, our compassion, our training, which not only earn us the trust of our patient, but the hope that we will step up and lead the charge to heal our healthcare system. And we are committed to this, take the time that it will for this fight, as long as it takes, because we understand the high stakes of what we do. You and I would not be here today if we didn't believe in the power of physicians working together. And so we must meet the challenge of this moment with our own call to action. True reform, lasting reform, won't happen without you, but the wrong reform will. And our AMA needs you. I'm asking you, and our profession is calling upon you today, right here in this moment. Keep telling your stories, those that make you angry and those that inspire you, because the world is listening. Keep advocating for your patients. Keep pushing for the future we all want. Our profession is worth it. Our patients are worth it. It has been the highlight of my career to participate in this House and later to lead the deliberations of this House that I love so much, to speak on your behalf and to carry this mantle of leadership for our profession. Thank you for the honor of being your AMA president. It's been a privilege of a lifetime.